beef from the butcher. Muscle is more simple. At butcher shop, your muscle is more similar with that than you think. The red part of this beef is muscle, and the white part is fat. Realize how the fat starts to infiltrate the muscle. This also happens to you. As we age, the muscular system is replaced by fat. Over here, we have the MRI of a sedentary 74-year-old, and we call this process sarcopenia. Look how in this case, there's a lot of fat literally replacing the muscle tissue. And next, we have the MRI of another aged person, now 74 years old, and this one has indeed been active his whole life. Look how there's more muscle mass compared to sedentary elderly. And today we know that the more muscle mass we have, the more time we have to live. There's more. Those who exercise, there's a chance of reducing it by up to 50%. The risk of neurodegenerative diseases, like Alzheimer's. On the contrary, studies also show that sedentary elderly people who lose muscle mass due to the lack of physical activity, especially in the lower limbs, these elderly people more chance of developing those neurodegenerative diseases. And there are people who don't even exercise every day, just on the weekends. These people reduce the risk of having more than 200 types of diseases. I'm Dr. Kelwin. I'm a phys therapist. In this video, you're going to learn how to reverse this process that replaces muscle tissue with fat. So how do we reverse sarcopenia? By doing this, you'll have a healthier life. And that's exactly the goal of this channel. So you can have a healthier life and be pain-free. To make sure you don't miss more videos from this channel, subscribe to the channel, give it a thumbs up, comment down below from which city are you watching this video, that I want to know how far this video has done really well. Remember that MRI I showed you of a sedentary person compared to MRI of a marathon running elderly person. The only way to reverse this process of sarcopenia is getting up from the couch to do physical activity. But don't worry, you don't have to go running a marathon. I'm going to show you some simple exercises, safe and impact-free, that you can do even at home. Then you copy these exercises that I'm going to teach you, and you can do them at your home. So let's go. Exercise number 1. For this first exercise, we're going to work on the glute muscles. These muscles are stabilizers of the knee joints, hips and spine. They strengthen these joints, and by doing this, you preventers. And top the glute muscles help you provide stability when you're walking to prevent falls. So for that, lie down on a mat, like I'm showing here, or on your bed, lying on your back, and do a hip lift. Lift your butt off the bed by raising your hips up. And then, lower your butt again. This exercise can be done in 3 sets, from 8 to 12 repetitions. 8 at the beginning the first few times, and then you can increase the number of repetitions to make you stronger. Exercise number 2. Now you're going to do a squat, improving the strength of your thigh. For that, you can sit in a chair in front of your window, or some other support structure, just to hold on to something, and you have to make sure that not even the chair you're going to sit on, and not even what you are holding, can slip or fall. So keep your knees aligned to perform the exercise in the best way possible, avoiding biomechanical deviations. To align your knee, you need to draw an imaginary line from your shoulders to your ankles. So then create a base of support, aligning your feet with your shoulders, and your knees need to be within that alignment along the line that you drew between shoulders and feet to avoid knee pain from overloading. I'm going to show you a very simple tip that can be really beneficial when you're doing this exercise. With this tip, you can prevent and treat your knee pain. And the tip is as follows. When you squat, don't let your knees go past your toes. So you look at your feet while you're squatting, and you need to be able to see at least the tips of your toes. If you can't see the tips of your toes, in words, if your knees go past that limit, the thing that you can see is the tip of your knees. So you might be overloading your knee. And that's not cool at all. If you still If you feel pain when doing these exercises, then you reduce your range of motion a bit. Like this here, right? Squatting to the point where you don't feel pain. In words, if you feel pain, you don't need to squat way down to sit in a chair. Go a little before that. Exercise 3. This is also a great exercise for our series of exercises for seniors. It's because it helps to improve the notion that you have of your body in space too, preventing falls and all those problems that I've already told you. For exercise, you're going to hold on. You're going to use that same support structure that you had already found for previous exercise, and you're going to lift just one foot, balancing on the other foot. Do 3 sets for each leg, keeping that single leg support position as long as possible on each leg. As you progress, gaining confidence, you can do this exercise without holding on. But hey, your hand needs to be really close to the support structure, even if you're not touching it, because if you lose your balance, you should hold on to it to avoid falling. Exercise number 4. For this exercise, we're going to strengthen the calf. So for that, stay in the same position as the previous exercise. But now, step with both feet on the ground. Stay on the tips of both feet and back. Do this for 3 sets of 8 to 12 repetitions. And again, increasing the number of repetitions as you keep gaining strength. This calf exercise, besides, helps prevent all those problems that I said in the video. It also helps a lot with circulation. We joke that the calf is our second heart. The first heart is right here in the chest. It helps pump blood to the head for the lower limbs, legs and feet. But for the blood to return, we don't have another heart down there, acting like a hydraulic pump, which has our heart. However, we have the calf, that we call the second heart. When the heart contracts, it sends blood down there. And when the calf contracts, it helps the heart to send blood back up there. And that's why it's so important to strengthen the calf, even for your circulation. So go ahead and save this video to do these exercises at least 4 times a week, because that really helps a lot to improve your quality of life, reducing that process of sarcopenia, which is the replacement of muscle mass with fat. By doing this, you're to have a lot of quality of life, a lot of health. You'll reduce joint pain. So always do these exercises. And if you want to know what the supplement is that I prescribe for most of my patients, can be combined with these exercises to improve muscle strength. This supplement too, it acts as a natural anti-inflammatory. It's great for arthritis joint pain. If you want to find out what this supplement is, I reveal it to you in this video here. To watch it, just click here and I'll see you there.